This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this new week. Thanks for joining us. WHAR for this Monday, and we have guests in the studio, which is always better to see you face to face. And Luella Gunter is with us, Executive Director of Philanthropy. Thanks for coming in once again.
Thanks for having me.
Good to see you. And Chris Battin is with us. She is the president of the auxiliary with Mon Health Medical Center. Chris, good morning.
Good morning.
Thanks
Excited to be here.
Yeah, thanks for coming in. Okay, so we've talked a lot about the upcoming events, and we'll touch on them again. The big one's the Ball of the Year, right?
Right.
That's the big event for the year.
November 2nd.
Okay, November 2nd for the Ball of the Year. We've kind of set the table a little bit, and there will be much more to come this fall talking about getting ready for that. But we're going to focus today on Mon Health's medical auxiliary. It's been 80 years.
80 years.
Hard to believe. Chris, what's your involvement, and how long have you been involved?
I'm the president of the auxiliary, and I've been the president for 4 years. Got us through COVID, and but I was on the committees for the ball years for several years, and then my ball was the 2017 ball. So then after that ball, I got more involved with the auxiliary, and then became president very quickly.
So you've been around.
Yes.
So you kind of got thrust into the role of president.
Yes.
All right. So what are the organizational aspects? Kind of take us through the levels of the auxiliary and how it runs.
So the auxiliary is a volunteer group. The hospital has two volunteer groups, and one of them is really involved with direct patient care at the hospital, but the auxiliary is more the community-based. We raise money for the hospital to meet the needs that our patients and our community need. So we're like we have a board of directors. They're all from all over the community. There's about 14 of us, and they're the eyes and ears of the community, and they look to see where the needs are. And then we bring it to our monthly meetings, and then if it seems important to us, to our patients, then we find a way to raise money.
So what drew you to this? It started with the ball, right? You said you were kind of in charge of 2017.
Yes.
That's a monumental undertaking to be at the top of that organization. What drew you to the volunteer work with the hospital and the kind of philanthropic work that you do?
I've kind of done it bringing up when I was all the activities that my children were involved in. I helped raise money, or I volunteered for their groups, whether it was hockey or lacrosse. So I was it's always been inside me. And then I got involved with the hospital, and then it was just really my first day as vol chair, serving as the committee member. There's like, can you run for president when you're done? So
See how we reel them in.
Yeah. Well, they always say if you need a task done, ask someone who's busy, because they're good at a lot of things. And Luella, what is the important, this seems like an obvious question, but can you kind of put into perspective the importance of the auxiliary and all of the things they accomplish and all the money that they help raise?
Well, they have raised over the years millions of dollars in support of the hospital. It's truly amazing when you look back at all of the things they have accomplished. I think that what I notice the most is the countless hours that they put into serving the hospital, but our community. Obviously I'm a paid employee of Mon Health Medical Center, right? But they do it, the auxiliary does it, our volunteers do it, because they support the mission. They believe in what we do at Mon Health, and they're compassionate and they care. And when you walk in and you see our auxiliary, when everyone knows everybody by first name and they ask you how your family's doing, that's called family. right? And that's what we love about our auxiliary.
So, Chris, you mentioned there's two aspects of it. There's kind of the community outreach and just getting things right for people, for patients, and for families who come through the hospital. If you're at the hospital, you're going through something difficult. So you deal with people kind of at a low moment, right? They're down a little bit. You try to make their life a little bit more manageable and a little bit more pleasant during this experience.
That's right. That's right.
So that's one part of it. And then there's the fundraising part of it.
That's right.
So how do you, again, those are two kind of two completely separate things. How do you handle them both?
Well, there are people that do both.
Okay.
I'm going to mention Mike Taylor, for example. He's a volunteer. He's someone that you see when you first walk in, and he sees a need for a wheelchair, and he'll bring you a wheelchair, and he'll take it to where you need to go. But he also serves on the board, and he'll say, "Hey, we need something," and he'll bring it up, and then we'll think, "Yes, we need to address that." So one of the issues we were talking about was we have a care cart. I'll put what Mike Taylor's job is. So Mike Taylor's job is employee appreciation, and he walks around with these little mints in his pocket, and everybody knows he's coming. And sometimes for some of the nurses, that's all their breakfast, and he'll be giving him the mints. But we now have developed a care cart, so we have little snacks and things on there, and it's a very colorful cart, and he'll bring it around to the hospital, and if there's any employees that need a little snack on the cart.
So taking care of staff and taking care of patients and taking care of patients' family, that's a big job.
Yeah.
It's a big job.
Yeah. 14 people on our board.
Uh-huh. All right, let's talk about some of the recent projects that the auxiliary has gotten behind and helped, and Luella, some of the recent projects that the hospital has undertaken.
Right. Well, the most current project that the auxiliary is involved in, and again, we talked a little bit about this the last time I visited with you, is the Caring Cottage project, our patient family stay house that we are building on property at Mon Health Medical Center for those in need, who travel a far distance coming in for medical treatment. So we're really excited about that. But they have there's been some significant projects funded through the ball of the year. In past years. For instance, our perinatal anxiety and depression program, we refer to it as P3, that is funded solely by private support. And because of 2 years of ball of the year proceeds, that's how that whole program was started.
So the Caring Cottage, and this has been fast-tracked, right, from the very top. This is a priority.
Yes.
Last time you were here, I can't remember when that was. Time just flies by. But the last time you were here, you said they were just breaking ground. So what's an update on that project?
The update is on July 18th, we held a celebration of our auxiliary's 80th year, and we also had the groundbreaking. So everything's in place site-wise. The foundation has been laid, and now we're just waiting on the modular structure itself to be built. So we anticipate that not being long at all.
Wow.
The heavy lift has happened. Yeah.
So a matter of months, just a
Yes.
few months, hopefully.
Absolutely.
Now, when that facility is open, what will it be like? That's for either one of you.
It's going to be like a home away from home.
Yeah.
It's going to have a nice little living area, a sleeping area, a little kitchen.
Yeah. It's a duplex style as well. So you can have two families staying at one time, which is what we really like, that we can kind of look at that and we can trend that because, as we've talked before, we have the ability to expand and grow as our patient needs grow. So we can go up to 6 different cottages.
So this is a facility for families of patients in the hospital.
Families of patients, but also patients themselves.
Okay.
I mean, we have folks coming in for oncology treatment, and maybe it's radiation, which they have to have 5 days a week, and it's extended. It can be up to 5 weeks or more, and they need a place to stay. So it can host both families and patients themselves.
All right, so the Caring Cottage is on a fast track. What are some other projects that are underway?
Chris, what are other projects we have?
Oh, gosh. So
A number of them.
yes. So we have how do we raise our money for all of our projects? So, like the projects we were talking about, that the millions of dollars, that comes from the little sales and things that we have at the hospital. But the football parking is probably one of our biggest. That's going to start with the Penn State game.
Yes, that's a little over a month away. It's hard to believe.
Yes, it is. So I'm expecting a full parking lots. We have lots of spaces for parking. It's really close. It's $20 for a spot. If you want to buy a season ticket, you get one game free. So you only have to pay $120 for that.
It's a deal.
It is a deal.
One game free. And we have RV parking.
Wow. Okay. So that's significant too, because those spots are at a premium.
Yes.
This, again, in order to raise the amount of money that you all raise for these, you have to be extremely creative. You have to come up with all kinds of different ideas. So, again, you've got the football parking. What are some other creative ways that you have to raise money?
And another one of our really big fundraisers, we raised over $10,000 last year, was our Trees to Go program. That starts in October, and it's wonderful. There's a display of beautiful trees. The trees are sponsored by various very giving donors, as well as decorated by folks, and they donate all their time and their money to decorate those trees. And then people can come and put their ticket into their favorite tree, so they could win one before Thanksgiving and not have to decorate one.
Yeah, I've been in there when the trees are on display. It's really spectacular. There's rows of them.
Yeah.
So you get a chance to see all that. Okay, so again, creative ways to raise money. We are with Luella Gunter, Executive Director of Philanthropy for the Mon Health Medical Center, and Chris Battin, the Auxiliary President. We'll take a quick break. We will continue the conversation. This is Mon Health Talk for this Monday, and we'll be back after this on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us on WAJR. We are with Luella Gunter, Executive Director of Philanthropy for Mon Health Medical Center, and Chris Battin, the Auxiliary President. And Mon Health Medical Center's Auxiliary is celebrating its 80th anniversary this year. So it's hard to believe, but 80 years of great work, and as Luella pointed out, millions and millions of dollars helped raise for projects and for patients and for things needed at Mon Health. So it's an incredible organization. Right before we took the break, we talked about the Christmas trees that'll be available in, is that late October?
Beginning of October.
Beginning of October, when the trees are on display and you can come in and bid for the trees. There's a couple months or a couple days left in the month of July, so you got a Christmas in July thing going on too, right?
Yes, we do. We have a beautifully decorated red, white, and blue Christmas tree right outside the gift shop. That was headed by Donna Pfeiffer and Joyce Wasick. The project is trying to collect clothes for our care closet. We have a closet that has clothes for men and women, sizes small to 2XL, of very loose-fitting T-shirts, hoodies, sweatpants. It's clothes for patients to go home in, because sometimes they don't have any clothes to go home in.
Yeah. Sometimes they come to the hospital in a very unexpected situation, right? And when it's time to go home, their clothes may not have made it. So that's a very good cause. So the Christmas in July, that event is still going on. You talked about the auxiliary. You said 14 members, right?
Yeah, there's 14 members on the board.
Okay, and you all volunteer.
Yes.
Volunteering is the lifeblood of a hospital, right, Luella?
Absolutely. We couldn't do it without the volunteers. They give us countless of hours, and they serve in so many different capacities, as Chris mentioned, whether it's getting a wheelchair for a patient or just walking them out from a procedure when they have to get to their car. I mean, they're always there. They're always willing to give a hand. They're a wonderful group of people.
So you need volunteers. There's always a need for volunteers. Speak to that a little bit, Chris, how people can help. If you're listening out there, if you're retired or you have some time off, you've got some time on your hands and you want to help, how can people help?
Oh, you can call Jacob Mulder. He is our director of volunteers, and he does a great job trying to. He's like keeps us all family and lets us know what's going on. His number, I'll give you his number. It's 304-285-6693. You can call him, and he will direct you to finding out what volunteer jobs. There are several different things, whether it's in the gift shop or working as a pathfinder. There's plenty of things that would be interesting to anyone.
And we want to find the right fit for you as a volunteer, right? I mean, hospitals can, as we all know, hospitals can be somewhat uncomfortable, but we all have different strengths and assets, and so we want to find the place where you're comfortable and you feel at home in Mon Health Medical Center. Okay, so if you're looking to volunteer, if you're willing to volunteer, call Jacob at 285-6693, 285-6693. Jacob, the coordinator of the volunteers. And he can also give you your football tickets.
Really?
Parking. Not tickets, parking.
Right.
Parking passes.
Okay. So he's in charge of that, too. That's a big one. So call Jacob if you're interested in parking, using the Mon Health facilities to park during football games, and you get one game free, right?
Get one game free if you buy a season pass. You can also buy your tickets when you arrive at football parking. We usually open up about 4 hours before game time.
Okay. So that noon Penn State game, 8 a.m.
8 a.m. it is.
Okay, very good. Now, also equally important is raising funds. So if people have it on their hearts to give financially, how does that process work?
So we have a lifetime membership wall. It's $150 to be a lifetime member, and it kind of gets your foot in the door as an auxiliary, but it also your name will get put on a plaque as a donor. That's like a donation to the auxiliary, and you can also do it in memory and honor of someone as well. But you can also give your time.
Right.
So you don't have to be on the wall to be a member of the auxiliary, and you can also call Jacob to get that connection with the auxiliary as well.
Okay, so call Jacob as well for...
He's a busy guy.
Yeah, he is a busy guy.
He's a busy guy.
Donation of time or money, give Jacob a call, 285-6693.
But we also want to make it easy for our donors and those who want to help us. So you can visit monhealth.com, go to our website, and visit the Medical Centers page. And there's all the information about becoming a volunteer and how that works. These phone numbers are also there with email addresses. You can learn more about the auxiliary and how to get involved. And also you can contribute for the wonderful projects that we've been talking about, caring cottages. You can give a gift to support, if you so choose, through our foundation's website. Our foundation partners significantly and collaborates with our auxiliary because it takes all of us to make it happen.
Yeah, absolutely. So the Ball of the Year comes up November 2nd. I know you're going to be very busy prior to that. What are some other things coming up?
Well, we have a golf tournament for the foundation on August 5th, so that's right around the corner. But you're right, the Ball of the Year is a Herculean effort on behalf of so many people. So honestly, for the next 3 months, we'll be preparing for that, and then we'll go into the Christmas trees in the main lobby. So it's,
there's always something.
Always something going on.
All right, so the golf tournament on August 5th is still a spot or two available?
There might be a couple spots left,
Do we call Jacob again?
Well, you could, but you'd better call me.
Okay.
It's better to call me.
All right, what's your number?
598-1889.
Okay. 598-1889. That's Luella's number if you're interested in getting involved in the golf tournament. Everything else, call Jacob.
Correct.
If you want to volunteer at the hospital, if you want to look into giving to the auxiliary, helping fund the auxiliary, call Jacob at 285-6693. Well, it's always an exciting time of the year. There's always something going on with the Mon Health Systems Golf Tournament, Ball of the Year, Christmas trees coming up. We appreciate your time. Thanks for coming in, and congratulations on the 80th anniversary for the auxiliary.
Thank you.
The great work that
Thanks
you
for
do with
us.
that. Chris Battin, auxiliary president, Luella Gunter, executive director of philanthropy for the Mon Health Medical Center. Again, ladies, thanks, and thanks for listening to Mon Health Talk Radio for this Monday here on WAJR.